Diabetes mellitus affects the lives of children, adults, and entire families, both mentally and physically. A sick child's social environment is also affected by the disease, as parents or caregivers must provide daily care to their child. Upon diagnosis of the disease, both the child and their family go through the stages of mourning. And there are 4 factors that can mentally, socially, or emotionally disturb the gradual and smooth development of a child with this chronic disease. Each phase of a chronic illness can present children and their families with significant challenges and stressors related to 1. The separation. 2. The deprivation of mobility and diet. 3. The effects of medical treatment. And 4. The effects experienced by the child related to pain, physical disability, and potential stigma. The purpose of this work is to present research findings related to the quality of life among parents of children and adolescents with diabetes, by focusing on the psychosocial well-being of the entire system around those experiencing the disease. The diagnosis of a chronic illness or disability, such as diabetes in a child, leads to family upheaval and disorganization. The effects of this stress on parents may not only negatively affect the mental health of the parents, but also affect the health of the child with diabetes. There have been several quantitative and qualitative studies in Greece and abroad that studied the burden and mental health of parents of children with diabetes. One study took place in Saudi Arabia, and 315 adolescent patients, aged 12 to 18 years, and their caregivers participated. The results of the study showed that early adolescents had a better quality of life compared to the group of adolescents aged 16 to 18 years old. This outcome has been attributed to the fact that older adolescents feel more autonomous and handle the insulin regimen by themselves with less parental influence, resulting in poor self-care management. Another study carried out in the pediatric hospitals in Greece aimed to investigate the socio-demographic factors that influence psychopathology, external shame, and the potential experience of shame of 285 parents with diabetic children. The findings showed that the duration of the illness was associated with a reduced intensity in the psychological impact on parents over time. A study investigating the pediatric stress experienced by fathers of children with diabetes showed that children experience low levels of pediatric stress. However, the correlating paternal stress may have effects on general family functioning as well as children's behavior. 43 fathers of children with diabetes completed a self-reported questionnaire. Another study examined the stress faced by parents and involved 134 parents of children with diabetes. The analysis showed that the stress experienced by parents is multifaceted and related to the age of the child and the socioeconomic status of the family. Finally, another study investigated parental stress and found that parents of children with newly diagnosed diabetes are at risk of developing depression, as well as feeling that their lives have changed, resulting in them experiencing constant emotional discomfort.